sports injuries, but you have to be back on track into regular profession. I'm Dr. Jayakrishna Reddy. I'm a joint replacement surgeon and sports medicine I practice. I do arthroscopic surgeries of shoulder, knee and ankle and complex trauma. I work at Yashoda Hospital, Secunderabad. So sports injuries is not the limit of a sports person. You can get back to your routine activities, routine game, whatever sport you are playing. The common injuries, if you see from shoulder, yes, there are chances of shoulder dislocation and cuff tear. There's a muscle tear in the shoulder, and the wrist sprains are very common. And knee is other common part to get injured while playing contact sports. There can be a ligament injury, there can be a cartilage injury, and the ankle is also other common injuries happen, like twisting of the ankle or direct hit to the ankle also can cause injuries. So to prevent all these things, first thing is you have to do your warm up well, you have to strengthen your muscles. Next is you have to go with a proper technique. And once if there is an injury at the ground itself, we can keep some ice pack, give some rest, and if the pain is not subsiding, visit your local doctor there. It should be evaluated with clinically, and if required, you may require a X-ray or MRI scans also. Example, if there is a knee injury, if there is swelling, you need rest initially for a few days and get a scan done and diagnose it. They are common like ligament injuries, common like ACL injury, PCL ligament injury or meniscus injury or cartilage injury. All these injuries can be treated well with arthroscopy surgeries. We put a camera and instruments through tiny holes and visualize the things and repair them or reconstruct it, either shoulder or knee or ankle. So you can be very well back on the track if you get treated well and do physiotherapy and rehabilitation later well. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.